WZTS LD 16 Hinton, Cozy TV.
Hello, and welcome to another episode of Doc Talk. I'm Dr. Paul Conley, and tonight my guest is Dr. Anita Stewart. Dr. Stewart has been gracious enough to come in tonight and give us an update on not only influenza, COVID, but other respiratory illnesses out there and how we can better protect ourselves. So, Dr. Stewart, thank you again for coming.
Hey, you're welcome. Thanks for having me. Excited to be here.
It's been a while, we've been off for a little bit, but now Doc Talk is back up and going, and I couldn't think of a better person to start off than with you because you've been so helpful throughout the years with Doc Talk. And so we're right in the middle of influenza season. We were talking even before that we went on about the numbers. And so I want you to maybe, if you can, just kind of give us an update of how things are going right now with our influenza and respiratory season.
Yeah, and I think, first I'd like to talk about where we are as a nation. We are having a higher than average flu season, so we would consider this a moderate to severe flu season. Across the nation, we've had about 15 million cases, and we're filming this just for timing's sake in January. So just know January 2026, we have had about 15 million cases. Of those, unfortunately, we've had about 7,400 deaths, and of those deaths, about 10 of those have been pediatric deaths, which is, we don't want to lose anyone to influenza, but certainly not our children. This year has, in West Virginia now, we are starting to see those increases. Remember, West Virginia typically falls behind the nation. We typically are kind of late to the party, which can sometimes protect us. It allows us to prepare ahead of time. But we are starting to see those increases. We've just wrapped up our holiday season, and this is around the time that we would typically see flu increase in our communities, and this year is no different in that. We're seeing that in our local communities where I practice and you practice, but also across the state.
So, one of the things, we talk about, we see this peak, and we see this, just like you said, we see it around the holidays because of just being in close contact. And now the kids, I think, we're talking about the numbers, but do you expect the numbers to continue to go up? Have we seen a peak yet, do you think, Dr. Stewart?
No, I don't think in our communities that we have seen a peak. I do think that, like you mentioned, we all got together for the holidays. People were traveling from different locations, coming together, sharing indoor, typically activities, and then now we're back to school, and what's better than sharing virus than our kids within schools. And so we are seeing increases within classrooms now. We're seeing large increases within the communities. We also are seeing some changes in our local emergency departments, urgent cares, primary care clinics with increased burden of respiratory type viruses at those sites.
So, when we talk about, 15 million with an M, so 15 million cases that have been documented, and we were talking about 7,400, individuals and 10 deaths that are pediatric. So when I think about influenza, we think a lot of times about the elderly with these deaths, but it can also affect, pediatric population as well. So in saying that, who is at risk when we talk about influenza?
Yeah, so you kind of touched on some of those categories. So really thinking about persons that are of advanced age, so anyone 65 or above, anyone with chronic diseases. So that is something like lung disease, diabetes, anything that would make our immune system not work as well, people that are obese, people that have sleep disorders. Those are people that are more at risk for having complications related to influenza. And then when we look at our younger populations, like looking at children that are under 5, and particularly children under 2 that have very narrow airways, that might have trouble clearing secretions, they're going to be more at risk for complications and lead to hospitalization and severe disease.
So, a thing I want to talk about too is testing. So when we talk about the 15 million cases, I can tell you, I do feel like that there has been some fatigue with testing. So I would imagine that these numbers may be somewhat falsely low, because I just know that even in the hospital, some people are like, I just don't want to test for whatever reason. So what do you think about testing and being tested for influenza?
Yeah, and one thing that I can share, I do think that the cases identified are likely low. I do think that we are looking at other creative ways to follow trends, such as monitoring wastewater, which we are doing within West Virginia as well, and that also helps us predict trends. But I do think you bring up a really great point that even if testing is available, and it's important for us to test and identify early, because we have therapeutics and treatments available that if we start them within 48 hours, that can actually reduce severity of disease and shorten the course of the disease. So get you feeling better faster, which is really important for our communities.
Yeah, I think it's one of those things that we even talked before the show that facts are our friends, and you want to have the facts so you have the data, but we can't manage things that we don't measure. And so if you're not testing and we just don't really know what you have, then we don't really know how to treat this. And to your point, we do have antivirals for the flu virus, influenza. And when we talk about influenza, there's influenza A and influenza B. So what are we seeing? Is it A or B? And do the antivirals that we have available, do they actually target one or the other or both?
Yeah, that's a great question. So this year, currently right now, we are seeing influenza A, which is, if you hear the term H3N2, that's the strain that we're seeing. Something that's a little different this year, and you might have heard about this on the news a little bit, is there was a little bit of a mutation of the flu virus. So remember, when we're making our flu vaccines and our predictions about the next season, we have to do that in February of that previous year. We base that on kind of what we've seen in the past and how the virus is behaving, and then we developed the vaccine to kind of match that. What happened this year, however, in the summer when it was in the southern hemisphere, remember flu is in the southern hemisphere in their winter months, which is our summer, there was a little bit of a shift, so they call that the subclade K. And what happened with that shift and that strain is it has allowed this virus to kind of evade our immune system, which means even if we've been exposed to influenza A in the past or had some immunity in the past, that this is a very sneaky virus. It wants to infect us, and it has found a way to kind of get around our natural immune system and to make us sick. And so we are seeing this H3N2 subclade K influenza A virus right now in the United States. It's the predominant strain. It's what we typically see first in the United States as an influenza A virus. And the difference again this year is that it is evading our immune system a little bit. We're seeing it spread very rapidly and fast. So you'll see if you're watching the flu map on the CDC, you might have a state has minimal flu activity, and then you look next week and they're bright purple, they're have severe disease and severe, high flu activity. So it is kind of happening fast. The good news is it does seem that the severity of the disease is very similar to previous years. So although we're seeing a lot more numbers, it doesn't seem like it's more severe, it's just more people are sick at the same time, if that makes sense.
So when we talk about the illness, so it is an influenza A is what we're seeing right now. And there is, again, and this is what these viruses do. I mean, they tend to shift and they can drift. And, to your point, we try to look at what they're doing in Australia and try to use that as a blueprint. But, as you say, the virus doesn't always follow the blueprint, and it can change just a bit. So in saying that, with these symptoms, it seems like a lot of times just kind of throw out, oh, I have the flu, and the symptoms may be more of a cold. So with these symptoms, how would someone present if they have influenza?
Yeah, so typically they're going to present Typically with the fever this year, we're seeing fevers related to this. We're also seeing either a cough or a sore throat is one of the criteria that we look for. A lot of times you will have overlapping cold-like symptoms, so like nasal congestion and just really not feeling well, lots of body aches, those types of things. But the hallmark is fever with cough and or sore throat.
So when we talk about fever, I was thinking about when we say fever, I think that can be a generalized statement. So what actually, as a healthcare provider, would you say that this is truly a fever? Are we talking about like 99, or are we talking about 100, 101? I mean, what kind of numbers are you seeing with the flu? Yeah,
so we consider fever anything above 100.5, and so like 100.5, and so thinking about anything above that would be considered a fever, and that would be without medication. So certainly if you're taking antipyretics, so things like ibuprofen or acetaminophen, that's going to lower, if you are having a fever, it's typically going to lower that. They reduce fevers. And so this would be a temp without those medications on board.
So how does this, work? Obviously COVID, and that's always the elephant in the room. So how are these symptoms different, if at all, with COVID?
Yeah, I think that's a really important point. I think it's hard to kind of discern, and I think that's why I think testing is really important, so you can shake out what's really happening, because we have medications to treat both of those things, especially for high-risk populations. And what we know is if we start those medications earlier, the better people do, the less severe outcomes they have, and the better they're feeling faster. And so it is really important to kind of discern what that is. We see patients and I think, oh man, this is a slam dunk, it's flu, and then we test them and it's COVID. And so even after years of doing this, I think that, certainly it's important to investigate and make sure that we identify things correctly.
Yeah, and I think that's, we want to be scientific about it, and we don't really shotgun approach. And so even though these are viruses, and we'll talk a bit more here about how we treat influenza specifically, but everyone's seen on TV, they've seen Pfizer with their advertisement with Paxlovid for COVID, mm-hmm. but Paxlovid has effectiveness against COVID, but you're not going to take Paxlovid for influenza.
Correct.
And so it's important to know what you have, and then we kind of get back to the testing. So again, if at all possible, if you can test, I think it's important to test, because then so then the healthcare provider will know specifically how to treat your illness. And I think that if you don't test, to your point, these symptoms sometimes really will overlap and they kind of meld together. And so it makes it somewhat difficult to tell. And then there's other viruses out there too, such as the rhinovirus and Coxsackie virus, and there's other viruses out there as well. And so I think most virus panels that we're really more looking at is going to be and some of these are combination virus panels, right? It's like COVID and influenza. So you get the test and they'll test for both, is that right?
Correct. And those are even available over the counter, and I think it's appropriate to get those over the counter tests. They're very good. And I think a lot of healthcare providers, when you call them and say, hey, I did an at-home swab, I got it from our local pharmacy, I did the swab, I was positive for flu, will you send me in some antivirals? Most providers are pretty good about doing that and or canceling you on if you're eligible or if you would be a good fit for that.
Yeah, so again, I mean, these tests are available, and if you can go and get this test, and then, even contact your provider, which, again, I think most providers would appreciate that, because if you come into the waiting room and you're ill, then you have infected patient in the same waiting room as a non-sick infected patient, and then we're trying our hardest to make sure that we don't, infect other people in the waiting room. They may have other, comorbidities that may cause illness there. So, I think that it is, again, very important that we talk about testing and the symptoms. Again, we talk about COVID, and it has changed as well, the symptoms. I mean, we have seen anything from sore throat to body aches to GI, and I think that that's the other thing too, is that oh, I just have sinus or sinusitis. But I think, unless you test, all our bets are off.
Yeah, and I think, again, it's even with all the specific symptoms, it's very tricky, and it's important to know so we know exactly how to treat you best and how to keep you safe and to follow up.
So we're getting ready to come onto a break. Dr. Stewart, please stay with me because we're getting ready to come back, and I want to have Dr. Stewart talk to me a little bit about, vaccines. Okay, there's been a lot of talk about vaccines. We're going to talk about that. I'm also going to talk a little bit about how can we treat COVID and how we can treat influenza. So stay tuned. We're going to take a commercial break, and we'll be right back.
You're watching Doc Talk with Dr. Paul Conley on WZTS 16 Cozy TV. Stay with us. We'll be right back after these messages.
Vandalia Health is proud to be a West Virginia-owned healthcare system, bringing together the hospitals and providers of CAMC, Mon, and Davis. We are dedicated to enhancing the health of our communities through clinical excellence. Our compassion and commitment remain the same with people you know and trust to care for you and your families. With more specialists, hospitals, and outpatient locations, we're delivering expertise and state-of-the-art care. Vandalia Health, expert care close to home.
Miss an episode of Doc Talk? You can watch Doc Talk with Dr. Paul Conley anytime on WZTS TV's YouTube page or on Facebook. Catch the latest episode or explore our full library of past shows. Already watching online? Check us out on WZTS Cozy TV, weekdays at 7 p.m. However you watch, thanks for tuning in. WZTS 16 Hinton Cozy TV is your local television station, serving Southern and Central West Virginia with classic shows and original local programming. Whether you're watching comfy classics you know and love, or content created right here by local voices, WZTS delivers programming you can rely on every day. Learn more about our station, programming, and coverage areas at WZTS.tv. Welcome back. Doc Talk with Dr. Paul Conley continues on WZTS 16 Cozy TV.
Hello, I'm Dr. Paul Conley. Welcome back to Doc Talk. So I have Dr. Anita Stewart here with me, Public Health Officer official, and we've been talking about influenza. And so, we've been talking about influenza. We've been talking about some of the symptoms. We've talked about the numbers. We've talked about how, the numbers are continuing to surge. So, we talk about, how do we prevent transmission of flu, but actually how do we prevent transmission of viruses and infections maybe in general?
Yeah, and I think these are common sense strategies that we've used for years and years that we know that really can help prevent spread. So really common sense things, like if you get sick, you should stay home. So if you have a fever, you're coughing, those types of things, please stay home and don't share that with others. The other thing is making sure we're washing our hands well so we're not transmitting germs, cleaning surfaces, having good ventilation in spaces. Even thinking about masking, I know that's kind of a charged topic, but certainly masking has been shown to reduce the spread of virus. And then again, just making sure that if you haven't had a vaccine yet, that you get your vaccine. It's not too late this season to do that, and vaccines are a great way to reduce the risk of severe disease and hospitalization for influenza.
So I know vaccine has been a really hot topic, and there's been a lot of discussion about vaccines and the safety of vaccines. So maybe you can walk me through a little bit about vaccine in general? Because, one of the things that you always hear all the time is, I'm not going to get the vaccine because when I get the flu vaccine, I get the flu. True or false?
That's false. The influenza vaccine is inactivated, which means there's no live product in it. And so you cannot get the flu from the injection. There are, I will say, the caveat to that is there are a few. In the past, there was a live vaccine that was intranasal that we would use, and you could, if you were sick at the time or immunocompromised, could get the flu from that. But from your regular influenza vaccine, that's an injection in the arm, you cannot get the flu from that. What people typically feel after that is either A, they've been exposed to another virus and then get sick, because it takes about 2 weeks for the flu shot to become active in our bodies and protect us. But really what people typically feel is their own body's immune system responding. So when they get the vaccine, their body says, oh wait, there's something different here. I need to pay attention to that and take care of it. And sometimes that can give us achiness. It can sometimes give us low-grade fevers. It can make us not feel our best sometimes. But that's really just our immune system kind of responding and taking care of that.
Typically, if you do have that response, I think of it as a good thing. That is your body's way of mounting up these neutralizing antibodies to fight that. But also, the symptoms are pretty short, not like the symptoms of influenza. So maybe you can tell us the difference between some reaction to the flu shot, which is a good thing, versus what is basically the time course of someone with influenza.
Yeah, so typically the reaction to the flu vaccine, like the swarm, the achiness, that type of thing, will last less than 48 hours. It gets better with a little bit of like Motrin or Tylenol, or acetaminophen rather, and it does tend to get better with that. Influenza virus, if you would become ill from influenza, it can last typically 5 to 7 days, sometimes even up to 10 days for some folks this time. And so I think, the duration, of course, is the biggest difference. And usually the severity of the illness is much worse if you do get sick from the actual virus versus the vaccine.
Yeah, I think people, that mistake, these symptoms of the vaccine. If you've ever had the flu, you'll know there's a big difference. Whenever you're so achy that the sheets touching your body hurt, you'll realize that you're much ahead to maybe get a little bit of that reaction to the vaccine. One thing about vaccines, again, you had mentioned earlier in the first segment that there is a bit of a mutation, there's a shift and there's a drift. I know people say, oh, wait a minute, well, if the virus has changed, does the vaccine, is it going to really help me? If it's not lock and key, if it's not exact match, what's the point of getting the vaccine?
Yeah, and I think that's a great question and a concern that every one of us have. And we certainly want it to be a good match, and we want to reduce hospitalization and reduce those numbers of people that are getting really, really sick. What we're seeing so far this year, and we've gotten some preliminary numbers from the UK, and what we're seeing with their vaccine, which is the same vaccine that we have here, we share those lots, is that they are seeing pretty significant protection, specifically for pediatric populations in preventing hospitalization and death, and then also for about probably moderate protection for adults at preventing hospitalization. And so remember, the goal of the vaccine isn't necessarily to prevent you from getting the flu, it's to prevent you from being hospitalized, from severe disease from the flu, and or from dying from the flu. The folks that we have that are very, very sick this year typically have not been vaccinated. Unfortunately, we've seen our vaccination numbers not only in West Virginia, but across the country and all of our age groups decrease, particularly over the past 4 years. But certainly that's no different here locally. I know here in our county that we're seeing about a 6% decrease in overall vaccination for influenza, looking at all age groups in this county, which is a substantial hit and certainly keeps our folks less protected and puts us at risk for having increased disease burden, more severe disease. And the big problem with that is then we have lots of people in the hospital, and then we have to figure out how are we going to take care of all these people in the hospital, and face it, like no one wants to be in the hospital and be really sick with the flu.
So I think, the take-home point, even back with COVID, I think there was this misconception that if I get the vaccine, then I'm totally immune, I will not get sick. And the reality is that that's not the case. That's not what the vaccine can do. But what it can do is give you immunity and antibodies to where the severity of the illness will be much, much less. Therefore, you recover much quicker than if you don't have immunization. And so I think that's, the take-home point. And again, the more people we can get vaccinated, if you have a handful or subset of people that don't, we talk about this term herd immunity. So if you have a group of individuals that get vaccinated, the few people that don't are somewhat protected because you have other individuals that are immunized. And I think that's also when you have such a low vaccine take rate, it just makes more and more people susceptible.
Yeah, I think that's right. And I think we're seeing evidence of that now, unfortunately. And but again, we still have several weeks left of flu season here. And what we typically see is a lot of times we haven't talked much about H1N1 or influenza B, which are also viruses that are, are within that vaccine that are protected against. And so we still typically see a spike in those in late winter, early spring. And so I do think it's important that if you haven't had your vaccine, that those are still coming down the pike most likely. Hopefully they won't be as severe as what we're seeing with H3N2, the influenza A. But I do think that it's really important if you haven't had your flu vaccine that you get your flu vaccine, call your healthcare provider or your local pharmacy, and try to get that. Again, it takes 2 weeks for it to be fully effective and protect you. But again, we have several more weeks of flu season to go.
So real quick, because I know we're getting right out of time, back to the vaccine. When should we get the vaccine? When do you recommend? I get that question asked me every single year. When should I get the vaccine, knowing that it peaks in 2 weeks? And are there types of vaccines? I hear about the high strength, the normal strength. Maybe you can tell us about that.
Yeah, perfect. My mantra I go by is flu before boo. So really thinking about trying to get our flu vaccines before the end of October.
So boo meaning
Halloween.
Gotcha.
So
Okay.
It's a great way to talk to kids and to get kids to make sure we're doing that. And then secondly, you talked a little bit about the differences in the vaccines. So as we age, our immune system isn't quite as robust. It's not as strong. And so we do have a high dose formulation that we recommend for 65 and above. And we do encourage those folks, because of their kind of less robust immune system, to get that higher dose vaccine. Again, if all we have available is the regular dose, I think that's better than nothing. But if you are 65 and above, we would recommend the high dose vaccine.
So high dose vaccine, we're getting right around time, and antivirals for influenza. What do we got?
Yeah, so we have 4 different antivirals that are available. And these are also widely available. We don't have any shortages this year, and they're working well against the H3N2 influenza A virus. So encouraging folks, trade names of those are Relenza and Tamiflu, or some that people might have heard of. They're very safe, they're effective, and they do shorten the course and reduce the risk of severe disease.
Well, I tell you what, you've covered a whole bunch, but I think the take-home point is get your vaccine, get tested. If you have flu, contact your provider, get treated, and we'll get through this flu season without having any more hospitalization and deaths as possible. So, Dr. Stewart, again, I really appreciate you. As always, you're always a wealth of information, trying to keep us safe, keeping us healthy. And I am Dr. Paul Conley. You've been watching Doc Talk. And until next time, I hope you have a good night.
WZTS 16 Hinton Cozy TV is your local television station, serving Southern and Central West Virginia with classic shows and original local programming. Whether you're watching comfy classics you know and love, or content created right here by local voices, WZTS delivers programming you can rely on every day. Learn more about our station, programming, and coverage areas at WZTS.tv.